All right, let's get into part 2 of the testosterone and androgen therapy. This part specifically addressed some of the finer details of using androgen therapy. And again, we're speaking for male hypogonadism, whether it's from a secondary cause or a primary cause. We have the options of oral androgens. Despite the advantages of cost and ease, these are not first-line agents because the effects of them are erratic. We'll talk more about that later. Transdermal testosterone is a popular option as well, but they have their positives and negatives as well. They do mention this, and please put this in as a pearl in your mind. If you ever are giving topical or gel, ointments, whatever, for testosterone, the secondary exposures to testosterone gel on uncovered skin and unwashed clothing has resulted in virilization in children. So these medications, if you're using them topically, have to come with a lot of patient education on how to go about not exposing other people to the testosterone. The principal disadvantages of the gel is that testosterone can be transferred to others by skin-to-skin contact. Because only about 10% of the applied dose is absorbed, and the other 90% of the dose will remain on the skin even after the gel dries. So in one study, blood levels of testosterone were doubled in female partners of gel users after 15 minutes of intimate contact that occurred within 2 to 12 hours. So testosterone transfer is a concern because the drug can cause virilization of female partners and can cause fetal harm. Okay, so big deal. The use of topical androgens and testosterone should come with a significant amount of patient education on how to be safe with this, especially around women and children, because you can have unintended serious consequences. So here's, this is something I would, star and read over as well, so that you have this on the front of your mind. They should wash their hands after every application. They should cover the application once the gel has dried. They should wash the area before they have skin-to-skin contact. Women and children should especially be cautious to avoid the skin that has been exposed. And the women and children who make accidental contact should wash the contaminated skin immediately. They tell people that in some of these gels and stuff, to prevent the transfer of the testosterone to others, patients should wash their hands, and after the gel has dried, keep the treated area covered with clothing because it can be washed off. They should wait 5 to 6 hours before showering or swimming. Again, the topical solution is that or the differences between the topical solutions they do talk about here is just where it's applied. Some of them is in the arm or the axilla or the abdomen. But again, that patients should not swim or bathe for 2 hours, and if an underarm deodorant or antiperspirant is used, it should be applied before applying the testosterone to avoid contaminating the deodorant or antiperspirant dispenser. So in other words, you put the deodorant on first, and then you would apply over that. And because of its alcohol content, the axilla one is liquid flammable, so they should stay away from flames until the solution has dried. Again, some serious teaching points that are really appropriate to have if they're going to be on these medications. And again, they can be transferred to others. The nasal gel is the newest formulation approved for testosterone administration, and it does seem to be a fairly effective drug, but of course it has the possibilities of causing runny nose or bloody nose, but they do have some of the specific education points here. And I'll let you read through those here, but essentially you need to make sure that you're cleaning the nasal tip after you've done it, and that you avoid blowing or sniffing for at least an hour after administration. They do have implantable testosterone pellets or buccal tablets that they could take, or intramuscular shots. The problem with the IM depot shots of the testosterone is that the blood levels can vary wildly. So your testosterone levels are higher than normal immediately, and then they decline to lower than normal before the next dose. So people can have this kind of the swings of the positives and negatives of being on that drug. So most popular type for people tend to be either now the new nasal gel or possibly even the shot, but even the oral medication can be difficult because on how you metabolize it, you can get a lot of variations in the levels of the drug, and therefore your symptoms aren't always a steady control state. When they talk about the steroid abuse, so androgen anabolic steroid abuse, this is something that we would need to be aware of and pay attention to for our patients, of course. What can they do for an athlete? The exogenous and androgens can significantly increase muscle mass and strength when given in sufficiently large doses. However, those potential side effects are significantly larger as well. Salt and water retention can lead to hypertension. It can actually suppress the release of LH and FSH, resulting in testicular shrinkage, sterility, and gynecomastia. Acne is very common. You have a reduction of your HDL cholesterol and you elevate your bad LDL cholesterol. So it theoretically accelerates the development of atherosclerosis. Most of the ones that are taken are the 17-alpha alkylated compounds, so they have significant risk for the hepatotoxicity and even kidney damage. So, and in women, you can become sterile and have menstrual irregularities. They can cause the depression, the mania, and aggressiveness as well. So again, down here to your key prescribing considerations for the androgens, I pointed out here that monitoring the serum testosterone concentration, your lipids, your liver panel, and your PSA, because remember that if they did develop, it doesn't cause prostate cancer, but if you were developing prostate cancer, it could accelerate that. So they have specific guidelines to monitor for that. And then to minimize the adverse effects is talked about here. So monitoring for any liver problems, high blood pressure, salt and water retention causing edema. And I did want to point out here that androgens can cause masculinization of the female fetus. So you need to rule out pregnancy before androgen use, if that would ever be used. And that they're given adequate contraception and using that wisely. And then again, the section on here talks about drug therapy for transgender men. The goal of the hormone therapy at this point is to stop menstruation and to stimulate the development of the male secondary characteristics, and that testosterone therapy can accomplish both of those goals. But again, you need to have very specific monitoring for this. So I do think that most situations like this would be referred to a specialist so that they know how to do it safely for the patient. And that is the end of the testosterone section. We'll come back with part 3 to talk about now BPH and other issues for men.